The patient unit. Definition: patient. A patient is a person who is waiting for or undergoing medical or nursing treatment and care. Patient care unit. Patient care unit is the space where the patient is accommodated in hospital or patient home where to receive care. The patient unit in the hospital is of 3 types. 1. Private room. Private room is a room in which only one patient is admitted. 2. Semi-private room. Semi-private room is a patient unit which can accommodate 2 patients. 3. Ward. A ward is a room which can receive 3 or more patients. Consists of a hospital bed, bedside stand, over-bed table, chair, overhead light, suction and oxygen, electrical outlets, sphygmomanometer, a nurse's call light, waste container and bedside table and others as needed and available. In the home, the client unit is the primary area where the client receives care. It may be bedroom or the main living area. Components of a patient unit. 1. Hospital bed. Gatch bed. A manual bed which requires the use of hand racks or foot pedals to manipulate the bed into desired positions, for example, to elevate the head or the foot of the bed. Side rails. It should be attached to both sides of the bed. Types of side rails. 1. Full rails. Run the length of the bed. 2. Half rails. Run only half the length of the bed and commonly attached to the pediatrics bed. 2. Bedside table or cabinet. It is a small cabinet that generally consists of a drawer and a cupboard area with shelves used to store the utensils needed for client's care. Includes the wash basin, bedpan, and urinal. Has a towel rack on either sides or along the back. Is best for storing personal items that are desired nearby or that will be used frequently. For example, soap, shampoo, and lotion. 3. Over-bed table. The height of this table is adjustable. Can be positioned and consists of a rectangular, flat surface supported by a sidebar attached to a wide base on wheels alongside or over the bed or over a chair. Used for holding the tray during meals or care items when completing personal hygiene. 4. The chair. Most basic care units have at least one chair located near the bedside. For the use of the client, a visitor, or a care provider. 5. Overhead light. Overhead light is usually placed at the head of the bed, attached to either the wall or the ceiling. A movable lamp may also be used. Useful for the client for reading or doing close work. Also important for the nurse during assessment. 6. Suction and oxygen outlets. Suction is a vacuum created in a tube that is used to pull fluids from the body, for example, to clear respiratory mucus or fluids. Oxygen is one of the gases frequently used for healthcare today. Oxygen is derived through a tube. 7. Electrical outlets. Almost always available in the wall at the head of the bed. 8. Sphygmomanometer. The blood pressure assessment tool has 2 types. 1. An aneroid. 2. Mercury, which is frequently used during nursing assessment. 9. Call light. Used for clients to maintain constant contact with care providers. Nursing staffs are not responsible for actual cleaning of dust and other dirty materials from hospital. However, it is the staff nurse's duty to supervise the cleaner who perform this job. General rules for cleaning. Dry dusting of the room is not advisable. Dusting should be done by sweeping only. Use a damp duster for collecting dust. Dust with clear duster. Collect dust at one place to avoid flying from place to place. Dusting should be done without disturbing or removing the patients from bed. Dusting should be done from top to bottom, for example, from upward to downward direction. While dusting, take care not to spoil the beds or walls or other fixtures in the room or hospital ward. While dusting, wounds or dressing should not be opened by other staff. There should be a different time for dusting daily. General instructions for care of hospital equipment. Use articles only for the purpose for which they are intended. Keep articles clean and in good condition. Use the proper cleaning method. Protect mattresses with rubber sheets. Use protective pillowcases on pillows. Do not boil articles, especially rubber articles and instruments, longer than the correct time. Do not sterilize rubber goods and glass articles together. Wrap glass in gauze when sterilizing it by boiling. Protect tabletops when using hot utensils or any solution that may leave stain or destroy the tabletop. Report promptly any damaged or missing equipment. Care of equipment in general. Rinse used equipment in cold water. Soak materials in recommended antiseptic solutions. Remove any sticky material. Hot water coagulates the protein of organic material and tends to make it adhere. Wash well in hot soapy water. Use an abrasive, such as a stiff bristled brush, to clean equipment. Rinse well under running water. Dry the article. Clean the gloves, brush and clean the sink. Care of linen and removal of stains. Clean linen should be folded properly and be kept neatly in the linen cupboard. Dirty linen should be put in the dirty linen bag and never be placed on the floor. Torn linen should be mended or sent to the sewing room. Linen with blood should be soaked in cold water to which a small amount of hydrogen peroxide is added if available. Linen stained with urine and feces is first rinsed in cold water and then washed with soap. Iodine-stained linen, apply ammonia, rinse, and then wash with cold water. Ink-stained linen. First soak in cold water or milk for at least 24 hours, then rub a paste of salt and lemon juice on the stain, and allow the article to lie in the sun. Tea or coffee stains, wash in cold water and then pour boiling water on the stain. To remove vitamin B complex stains, dissolve in water or sprit. Mucus stains. Soak in salty water. Rust. Soak in salt and lemon juice and then bleach in sun. Care of pickup forceps and jars. Pickup forceps is an instrument that allows one to pick up sterile equipment. Sterile equipment. Sterile equipment material, which is free of all forms of microorganism. Pickup forceps should be kept inside the jar, in which 2/3 of the jar should be filled with antiseptic solution. Wash pickup forceps and jars and sterilize daily. Fill jar with disinfectant solution daily, such as Dettol or preferably carbolic solution. Care should be taken not to contaminate tip of the forceps. Always hold tip downward. If tip of forceps is contaminated accidentally, it should be sterilized before placing it back in the jar to avoid contamination. Rubber bags. Example, hot water bottles. Ice bags should be drained and dried. They should be inflated with air and closed to prevent the sides from sticking together. Rubber tubing should be washed with warm, soapy water. The inside should be flushed and rinsed well.